whatever it takes in the interest of our patients. My medical colleagues from across the Apollo ecosystem and members of the Apollo family. Happy Doctors' Day to every one of you. This is a day for us to pause, reflect, ruminate, and celebrate. Reflect on the unique opportunity we have of touching lives and creating a little magic every day. A time to pause and celebrate the journey so far, where we have made extraordinary something that we take for granted. And it's not just us. Every patient who walks into the doors of Apollo takes that extraordinary clinical outcome for granted. And so we have a huge responsibility going forward. As an Apollo doctor, you have defined what it means to be a clinically excellent clinician. You have charted the course of healthcare in this country, and you have defined the boundaries of clinical excellence, boundaries that you push each day. We are proud to be a part of this great team. We are proud to have walked this journey with you. As administrators, working with you has been engaging, energizing, often exhausting, sometimes exasperating, but above all, it has been inspiring and fulfilling. And when we come to work each day, we know the day may not be easy because we have to measure up to your expectations. And I can assure you on behalf of all of us in admin that we do our best to make sure that we live up to your expectations. But we know that at the end of the day, it would have all been worthwhile for the sake of the patient and for what needs to be done to make sure the patient goes home happy, healthy, and smiling. So once again, I'd like to wish all of you happy Doctors' Day. It's been a great journey so far and great things lie ahead. Happy Doctors' Day.
Thank you so much, ma'am, for your great message. To celebrate this great day, we have created a special video to value the contributions of our doctors. May we have the video, please?
At the end of day is a restful night, except for those who make things right. They find themselves not in bed, but by a bedside, holding a hand, a scalpel, a defibrillator, a report, helping the world hold on to hope, fighting for a life, bringing the joy of a new one to life. Every night, ambulances race. Every night, weary feet keep pace. Every night, there is another difficult case. Every night, there is a cause to trace. Yet, every night, there is a comforting embrace. And as the night turns to dawn, a doctor somewhere suppresses another yawn. Knowing it's she who brings the light, he is who makes it right. A Doctor's Day includes the night. Apollo salutes the doctors who give life the might to make it through the darkest night. Happy Doctors' Day and night.
It truly was a wonderful video. I now request our Joint Managing Director, Ms. Sangeeta Reddy, to address us all. Sangeeta, ma'am.
Dear doctors and dear members of the Apollo family, namaste, good morning, and a very, very happy Doctor's Day to you. There are so many things that I could say about how much we love, we care, so many wonderful instances where you have inspired. And I just wanted to convey something because I know, there are so many people to speak to you today, but I just wanted to convey one very important message, and that is that there is so much that you have achieved and so much that you've done. There is so much more that we can collectively do together. And in that journey, I want to commit to all of you that I will spare no effort, no moment, no time. I will spare none of that to be by your side, because I truly believe in your mission. I believe in your purpose. I believe that together we stand at Apollo for making the world a better place for our patients. And we will use every technology, every capability, every science, and we will be relentless in our exploration of these. So just to say, I'm with you, I admire you, and I thank you. Namaste.
Thank you so much, ma'am, for your inspiring message. I now request our Executive Vice Chairperson, Ms. Shobhana Kamineni, to address us all. Shobhana, ma'am.
Taking on from Sangeeta, first, happy Doctors' Day. I think it's not just one day that we celebrate you. There are millions and millions of people around the world that you're making their lives so much better, and you're actually extending their life. So I think that what better purpose than this? Just two messages. I think that what Sangeeta said is that we're here to fully support you. This is something that Chairman taught us very early. Not only that we played the supporting cast to his amazing greatness, but I think that what he said was, I want to give in Apollo every doctor the ability to be his best. And to do that, it requires the support and infrastructure that he doesn't have to waste his time thinking, will this medicine come, or will this theater be ready, or who's going to look after my patient once I'm done. So I think the fact that we built this fantastic infrastructure is only because of you, for you, and now truly by you. And having said this, I think the perfect example is what Apollo is moving into. The Apollo 247 has really been built for that purpose. If you look at when March 22nd, 2020, when lockdown happened, within 45 days, 3,500 of you started, on the platform, and you were touching your patients all over again. And I think no better thing, no better demonstration than what was Chairman's vision for Apollo at that time. And want to just reinforce that today, as we go strength from strength to strength, we know that whatever we do for you is directly translated to saving a life. And I think that's what makes all of us being part of Apollo worthwhile. So happy Doctors' Day again.
Thank you, ma'am, for your wonderful message. I now request our Managing Director, Ms. Sunita Reddy, to address us all. Sunita, ma'am, please.
Good afternoon and namaste. Happy Doctors' Day. It's such a pleasure to be with all of you on this very special day. When you think of doctors, people wait for this recognition when they will become stars. But today, especially, we recognize that all of you are stars. And in that journey of becoming stars, I think, you have done so much. Medicine is constantly evolving. And in the past 24 months, we've realized how unpredictable it is. But the lessons of the last 24 months has been that our ability to collaborate, to work with doctors from across the world, we were able to find solutions. And I salute you for that, because that is truly remarkable, that you were able to face this virus, which really changed the face not only of healthcare, but of the economy. But more importantly, what was our learning from that? The learning from that is that together we can do so much more to make the world a safer place. And we can do so by keeping an open mind to learn from Chairman. Chairman was a pioneer in many ways. Not only did he bring the first corporate hospital to India, but he pioneered bringing new technology. And all of this to support cure with the patient in the center of everything that we do, because everything was patient-centric. So today we need to move beyond just diagnosis and treatment. We need to move to preventive healthcare, like you said. Today's world is not just about treating a virus. It's gone far beyond. And the solutions will come by working together and by using, my sisters Shobhana and Sunita have done so much in terms of technology, but by working constantly with them to use technology to make the world a better place. And I do want to say that we're here to support you, because I come to work excited every day, knowing that I'm going to learn something new, and the application of that something new is going to make all of us at Apollo more, we to make a greater social impact. And that is what we're here to do. I think Hippocrates said that the practice of medicine is the art of medicine is not just about loving medicine for the sake of treatment, but it is about loving humanity. And I believe that that is what you all do. And I thank you for all the good work that you've done for the past, for the past 2 years. But I look forward to a decade of innovation and change and learning, where we can impact the society in a much more meaningful way. Thank you for everything that you've done, and may God bless you and your families. Namaste.
Thank you so much, ma'am, for your energizing message. I now request our Executive Vice Chairperson, Dr. Preeta Reddy, to address us all. Preeta, ma'am.
Happy Doctors Day to all our clinicians, within the Apollo family, within the extended Apollo family, and a lot of the clinicians who really drive decision-making, patient care for us across the globe. It's an amazing day to really acknowledge the kind of work which happens with every clinician within the Apollo system. And I would also like to thank the management team, because, they provide a seamless support system for our doctors to really perform the way that they need to perform. And they learn from them to see how can we provide an ecosystem that our clinicians can outperform themselves. I was just walking into the hospital today, and just near the cath lab, a family met me. They were just standing there and they said, "Can we talk to you for a minute?" They had taken this patient to Singapore, to one of the best centers there. They said, it's impossible, we can't do anything here. They quickly flew here, very successful mitral clip done. Patient is ready to go home, maybe by this evening or tomorrow, but the family was just standing there. And I think every day, in every Apollo, these stories happen. My job here is only to say thank you to all the amazing clinicians who really make a difference in families' lives and the patients' families' lives. And I would also like to say that we are here to support that dream, to support that vision. Chairman did it when he started the Apollo hospitals, the whole group, the whole ecosystem which it has grown into, only because he wanted to provide that kind of care to patients who could not go abroad for treatment. Today, thanks to all of you, our clinicians, patients from abroad come to India for treatment. We are known as a clinician-driven hospital, doctor-driven hospital system, and we want to stay like that. We want to be like that, because to me, you are the core of what Apollo does, day in and day out. It also is very clear to us from, you've heard Sunita, Shobhana, Sangeeta speak, that it's not enough to just do what we're doing very well today and be a center of excellence. We really have to think and plan for tomorrow. And there are multiple plans, thoughts, ideas which have been implemented already within the Apollo system, and we will continue to do it, because it's not right for either us, the managing team, or for all of you as doctors, for us to say, okay, we've done very well and things will go on the way it should go. We have to think into the future. We have to try and learn and understand from our counterparts around the world. And maybe with research, academics, excellence, innovation, we can actually bring ideas and thoughts which can teach the rest of the world a better way to do it. And in multiple formats, it has already been done in India. People come to us for advice for more cost-effective methodologies. They come to us to say, how did you manage to do this many procedures when we are in a very well-known healthcare system only doing 1/10 that number? So we're already doing it, so let's, as an institution, come together and do so much more, because I think as a team, you are unstoppable. You are a force that keeps raising the bar, and you are a force which will make a difference in the healthcare, not only within India as a country, but for the rest of the world. I think the Apollo doctor today is actually, and in the true sense of the word, a global citizen. So God bless all of you. Thank you for being part of the Apollo family. We as a team always look up to our clinicians, and we will continue to be there as a support system. Thank you, and God bless. And lots of love to you and your families, especially to the families for allowing you to do the kind of work you're doing. Because if it was not for the support system you have at home, I don't think you can serve day in and night at the Apollo system. Thank you.
Thank you so much, ma'am, for your amazing message. To even better, we have a video on Apollo Clinical Excellence. Can we have the video, please?
Namaste. Apollo Hospitals Group is India's largest integrated healthcare provider. We have more than 10,000 beds across 75 hospitals with 8,000 clinicians in 55 specialties. We have Cradle, a network of birthing centers, Spectra, a chain of daycare centers, Fertility, a network of IVF centers, 1,300 plus diagnostic centers, a chain of dental clinics, a network of dialysis clinics, Sugar, a chain of clinics for pre-diabetes and diabetes, 260 plus primary clinics, India's largest pharmacy chain that will soon achieve the landmark of 5,000 pharmacies. Apollo MedSkills is the largest healthcare skilling institute in India. UR Life is our wellness platform. Family Health Plan Insurance is a TPA with a pan-India presence and a network of 14,000 plus healthcare providers. Medvasti is Asia's largest and fastest growing health edtech company, having positively impacted the careers of 500,000 healthcare professionals across 192 countries. Leveraging nearly 4 decades of experience, we have designed Apollo Pro Health, a unique AI-enabled personalized health management program. Apollo Home Care has provided holistic care at home to 330,000 patients. Apollo Global Projects Consultancy has been engaged in 54 projects in 32 countries. Apollo Telehealth provides a spectrum of services breaking geographical barriers. Apollo Hospitals Education and Research Foundation, Apollo Research and Innovations, and Apollo Knowledge administer state-of-the-art research and academic programs. For us, clinical excellence is a scholarly approach to clinical practice with passion, passing on this mastery to the next generation of doctors and collaborating to enhance research. Our patient care stands on the 3 pillars of clinical, academic, and research excellence. For us, clinical excellence is giving hope to Mahindra with Nemaline rod disease, who has seen the world upside down his entire life. Mahindra after corrective surgery. For us, clinical excellence is giving hope to this family with conjoined twins that Abriana and Adriana can lead independent lives. Abriana and Adriana after their separation with the founder and chairman of the Apollo Hospitals Group, Padma Vibhushan, Dr. Preeta Reddy. For us, clinical excellence is giving hope to the parents of Sanjay with liver failure that after a liver transplant, he will lead a normal life. Sanjay is the first child to have received a successful liver transplant in India at Apollo Hospital, Delhi in 1998. Sanjay had discharged. Sanjay 4 years later, Sanjay 10 years later, Sanjay 15 years later, when the government of India issued a postage stamp marking 15 years of successful liver transplantation in India. 23 years later, Sanjay is now a doctor caring for patients at Apollo Hospitals, Bangalore. The highest rated hospitals are high volume institutions as best outcomes correlate with high procedure volumes. We have India's finest clinicians, hardwired system and processes developed over 39 years that ensure excellent outcomes. We have performed 200,000 heart surgeries, 300,000 angioplasties, minimal access cardiac surgeries, complex neonatal and pediatric cardiac surgeries. Structural heart interventions like TAVI and Mitra clip are routinely performed. We've completed 1 million consults in patients with a malignancy, performed 3,000 bone marrow transplants, established 14 comprehensive cancer centers that provide radiation therapy, medical oncology, pediatric oncology, and oncosurgery, including robotic surgery. We have performed more than 370,000 orthopedic surgeries, including robotic joint replacements. Comprehensive subspecialty services are provided. More than 180,000 neurosurgeries have been performed. All subspecialty services are offered, including robotic spine surgery. From performing India's first successful pediatric and adult liver transplants, first successful combined liver and kidney transplant, more than 20,000 solid organ transplants have been performed. Kidney, liver, combined kidney, liver, heart, lung, combined heart, lung, pancreas, combined pancreas, kidney, and small bowel. Since 2012, every year more than 1,200 solid organ transplants have been performed. Even during the pandemic, 814 transplants were performed in 2020, and now every day, 4 transplants are performed. If any technology is available anywhere in the world, we brought it first to India because India deserves the best, be it cyberknife, robotics, or proton therapy. The Proton Therapy Center in Chennai is the only proton center in Southeast Asia. When COVID struck, we deployed a 360-degree approach and launched Project Quach. The Quach experience was published in the NAJM Catalyst. We treated more than 250,000 COVID patients, developed the capability to perform 10 confirmatory COVID tests per minute, participated in 25 clinical trials, and administered 5.5 million vaccines. We ensure that our patients are treated in a safe environment. Our hospital in Delhi was the first in India and the 6th in Asia to get accredited by Joint Commission International way back in 2005. All our major metro hospitals are JCI accredited, which is considered the gold standard in global healthcare accreditation. All our non-metro hospitals are accredited by NABH, the Indian accreditation body. What patients and clinicians want goes beyond accreditation. They want excellent outcomes. We developed Apollo Clinical Excellence, ACE, a clinical balance scorecard in 2008. ACE is a case study at the Ivy Business School in Canada. We have 25 parameters that are benchmarked against the world's best published outcome. Each of our hospitals is expected to be in the green zone for each parameter every month. As an example, the best published survival rate after coronary artery bypass graft is 99.4% from the Cleveland Clinic. If our hospital has a survival rate which is comparable, it gets a score of 4 and 4, but with a mortality of 2.1%, it would get a score of 0. Many hospitals in the world would aim for survival close to 98%, but our hospital would get a 0 at 97.9%. Data from each hospital is reviewed and presented to the board. Remuneration of the CEO, COO, CFO, and medical director has been linked to clinical outcomes. We've developed the Apollo Standards for Clinical Care task that includes ACE, the Apollo Quality Program, incident reporting, mortality review, safe surgery, and ICU checklists. More than 1,000 trainees, 8% of India's national board trainees train in 45 specialty residency and fellowship programs at Apollo hospitals. We have 2 medical colleges in India, medical school in the UK, 11 nursing colleges, an institute of hospital administration, and a physiotherapy college. Our journal, Apollo Medicine, was launched in 2004 and is published every quarter. We have a robust presence in clinical research with an experience of 1,150 clinical trials involving drugs and devices. We have a biobank, a cord blood bank, and a growing interest in biomarkers and genomics. The Apollo team has worked on the design, development, and deployment of artificial intelligence-based APIs for clinical decision support for cardiovascular diseases, prediabetes, diabetes, liver fibrosis, antibiotics use, COPD, and asthma. Our AI COVID risk score saw 16 million downloads. With 4,149 publications, we have the 3rd highest number of publications in India on PubMed. Our telemedicine network was inaugurated by President Clinton in 2000. From 12,500 feet in the Himalayas to a presence in 48 countries. From e-urban healthcare centers to tele-ophthalmology to digital dispensaries, to an e-ICU program, to teleradiology through Apollo Radiology International providing radiological services across India and beyond, to digital pathology linking pathologists across India covering 13 subspecialties of pathology. 13 million lives have been touched through Apollo Telehealth. Based on the learnings of 22 million health checks, ProHealth, the AI-enabled personalized health management program, has shown impressive improvement in clinical parameters of individuals through personalized, proactive, and timely interventions. Apollo 24/7 is the fastest growing health care platform in India with over 17 million users across 450 cities. This new age end-to-end omni-channel platform offers a full bouquet of healthcare services, 24/7 consultation, seamless medicine delivery at home across 19,000 PIN codes, diagnostic test booking and doorstep sample collection, digital health records and more. The Apollo Total Health Program in Aragonda and surrounding villages in the state of Andhra Pradesh for a population of 70,000 people, encompassing physical, mental and social health, ecology, spiritual well-being and economic fulfillment is now a case study at the Harvard T.H. Chan School of Public Health. Many honors have come our way, including 2 case studies from Harvard Business School, international and national awards and recognition. The greatest honor is that 4 stamps have been issued marking our achievements. 25 years of service to the nation, 15 years of liver transplantation in India, performing 150,000 open heart surgeries and completing 20 million health checks. We are privileged to have earned the trust of 200 million individuals from 140 countries. Thank you.
It was truly inspiring to see all the contributions made by our members working across the hospital divisions, the clinics, the diagnostic centers, the pharmacy, Apollo 24/7, telehealth, education, research, and it's amazing to see everyone that has made such a huge difference. Thank you for such a wonderful video. And with that, we have come to the end of our Leadership Connect. And I'm sure I speak on everyone's behalf when I say that it has been a truly amazing experience. My special thanks to our beloved Chairman, sir, and thank you, Preeta ma'am, Sunita ma'am, Shobhana ma'am, and Sangeeta ma'am for being here today. And thank you, Rohini ma'am, for connecting with us today. Now that this Connect has started this special day in such an amazing way, let us keep the energy high. Units have planned various activities and events for you, so please do join us for this celebration. Namaste and happy Doctors' Day. Thank you, ma'am. Thank you for joining. Thank you for your time.